Good afternoon. Thank you for tuning into the Health and Wellness Hour right here on the People Station, 93.7 FM. Today's show is sponsored by MUSC Health Orangeburg. Today we're celebrating Women's History Month, and I'm here chatting with Dr. LaShondra Morgan. She is with MUSC Health Orangeburg. She is the Tri-County Health Network Manager. Thank you for joining us today, Dr. Morgan.
Hi.
Tell us a little bit about yourself and what it is that you do for the hospital.
So my name is Dr. LaShondra Morgan. I am the Tri-County Health Work Manager, meaning that I oversee operations with the Tri-County Health Network and the coalition. We have a coalition of community partners that meets on a monthly basis because we like to, we don't believe in working in silos. We believe in collaboration and working together. And then with the Tri-County Health Network, we are the community engagement arm of the hospital. We do wellness, we deal with the social determinants of health, and policy systems and environmental changes.
So are you located here at the hospital or do you have an office offsite?
I am located here at the hospital, but I tell people if y'all see me in my office too much, that means I'm not doing my job.
Right.
I am a community health worker, so a lot of times you'll find me out in the community. So if I ever give you my card, never call my office number because I'm not there.
So you said that you work with a team of people in terms of building coalitions and collaboration. Tell me a little bit about how that works and what's the goal of those types of partnerships.
So when it comes to collaborations, a lot of times organizations have shared goals. And so we try to do what we can to support each other. So when we have our Tri-County Health Network Coalition meetings, the first thing we do in those meetings is and we introduce ourselves for any of the new people in the room. A lot of us have been working together for years, but we always start with coalition updates so we know what's going on, what people are planning to do, and how we can support each other.
Okay, so give me some tangible insight on what it is that you do. You go out, you work with partners to go out into the Tri-County area. Define that.
Okay. So, well, with Tri-County, there's actually a bunch of Tri-Counties in the state. I specifically work with Orangeburg, Bamberg, and Calhoun County.
Okay.
And so, well, for me in particular, since I do policy systems and environmental changes, I keep my ear very close to the community. We have community conversations. So I'm not sitting in a public health bubble and deciding for the community what it is they need to do. Right. We listen to the community members. We look at the data to see what the community needs, and then we make decisions from there.
Okay.
Yeah.
So what are some of the things you found in your community surveillance in terms of what the Tri-County community actually needs, and what have you all put in place to address those needs?
So in our community, we have a lot of health concerns around diabetes, hypertension, cancer, things like that. Last about year and a half, 2 years, we've been working with the South Carolina Cancer Alliance on a project with African American men in cancer. The top cancers in our area are prostate, lung, breast cancer, colorectal cancer, and pancreatic cancer. Yeah, and so we've also, with the South Carolina Cancer Alliance, they partner with Clemson Rural Health, and with Clemson Rural Health, they actually, in most cases, provide they cover the cost of prostate exams.
Oh, wow. That's important to know. We're going to take a break, but when we come back, Dr. Morgan, I want to talk about some of those social determinants of health and actually what support services are in place and what those outcomes have been. Don't go anywhere. We'll be right back. It's the People Station. Welcome back to the Health and Wellness Hour. We're still chatting with Dr. LaShondra Morgan. She's a Tri-County Health Network Manager with MUSC Health Orangeburg. Now, Dr. Morgan, before we went to break, we were talking about some of the chronic illnesses that you see in the Tri-County area. You were speaking a little bit about some of the social determinants of health. Tell us a little bit about what you found with that.
So with social determinants of health, that's just a big fancy term to talk about anything that is non-medical that can impact your health. Things like neighborhood, social context, education level, things like that. And so access to care and quality of care, things of that nature. And so I also am the outreach director for Healthy Me, Healthy SC. And with that organization, it is a collaboration between MUSC Health and Clemson Extension. We target community members that are insured or underinsured.
Okay, so when you say target community members, how does that work? So if someone is uninsured or underinsured, how do they connect with you, or how do you connect with them?
So the way we connect with them is we go out into our most rural pockets in the community, because a lot of times those areas have low access to care, which is a social determinant of health. And if you're or underinsured, that also limits your access to care. And so we actually go out into the community. So we call on our community partners, like from the Tri-County Health Network Coalition. And if people offer health screenings, or they're a community serving organization that offer resources to the community that can help them, we all get together and we go to these different locations, and we offer free screenings, free food. We pass out free groceries and things like that. We have this great organization called Groceries on the Go.
Oh.
Yeah, they actually will deliver. So if you don't have transportation, then you can still get your healthy food
Now,
delivered to you.
how do they connect with you to be able to sign up or get on the list?
So we really advertise things out in the community. We know where the hot spots are in the community. Partner with local municipalities so that they can get the word out to community members.
So that's like what, city councils? Are you partnering with any churches?
Yes, churches are the backbone of public health.
Yeah, definitely.
Yeah, most definitely. And so we connect with those organizations, and they get the word out for us. And the most recent one will be is Bowman, and so like the Bethune-Bowman Middle High School, they're getting the word out to all of the parents, who hopefully they'll even spread the word to their peers and their neighbors, and hopefully we'll have a good turnout.
Yeah, I think when people know about these things, they'll be more apt to come, especially if there's food involved, any type of incentive. So we're going to take a break, Dr. Morgan. When we come back, I want you to tell our listeners and our viewers how they can get in contact with you and how they can connect to some of your resources. Okay. We'll be right back. Thank you for sticking it out with us on the Health and Wellness Hour, sponsored by MUSC Health Orangeburg. We're still chatting with Dr. LaShondra Morgan. She is a Tri-County Health Network Manager at MUSC Health Orangeburg. Dr. Morgan, before we went to break, you talked about the social determinants of health. You talked about groceries on the go and partnering with those communities who are really in desperate need or in dire need of health information and support. Now, what do you all do, or have you all put in place to provide information on preventative measures or early signs of potential cancers, and what to do in the event of?
We really are an organization right now that is supporting our partners, and so we promote any information that our partners would like for us to promote. Like sometimes folks reach out to us and we'll put it on our Tri-County Health Network Facebook page, or if we're invited to a health fair and there's information that they would like for us to pass out, then we'll pass out that information there.
So give the handle for your Facebook page.
So you can go to Facebook and type in Tri-County Health Network or at Tri-County HN. And if you have questions, I manage the page, so you can reach out. That'll be a direct way to get in contact with me. Or if you would like to email me, my email is morglash, MORGLASH, at musc.edu.
Well, thank you so much for joining us and providing this great information. Your experience as a community health manager, a community health worker, really positions you to be able to be out in the community and providing information and resources and really building coalition.
Yes, thank you.
You're welcome. Thank you all for joining us today for the Health and Wellness Hour, sponsored by MUSC Health Orangeburg. Until next time, it's the People Station.